Many women have been asking me recently questions like, doctor, why do I keep having infection? Doctor, I just bought some drugs 2 months ago for infection and now I'm still having infection. They keep asking me questions like that. All right, because this infection is one of the disturbing diseases that affect women. All right, and when you have infection, especially infection of your prepuce, all right, there are certain symptoms that you experience. Number one, you'll be having discharge. When there's infection of your prepuce, you'll be having discharge. All right, discharge, and this discharge can be, the color of the discharge might be greenish, deep brown, or very yellow. All right, it is not the normal discharge that women used to have. By the time you see this discharge, even you yourself, you know that you are having infection. All right, number two symptom that they will have is that they will have itching around the prepuce. You just discover that they have itching, pruritus around the prepuce. The third thing that they will have, they will discover that the odor of the discharge is the discharge has odor. The odor is offensive, malodorous. All right, you will know when you have this infection. Nobody will tell you. If you are a woman and you have infection, you will know that this one is not normal. All right, and one of the things that predispose a woman to having infection is multiple sexual partners. There are many things that predispose a woman, but one of them is multiple sexual partners. Multiple sexual partners simply means that you are a woman, but you have different girls in different locations. All right, or you are a woman, you have a man. All right, that have different girls in different locations. That's multiple sexual partner. Another risk factor that predisposes a woman to having infection is unprotected sexual intercourse, skin to skin, no condom. That's unprotected sexual intercourse. By the time you do that, you are predisposing yourself to having infection. All right. Another risk factor is what we call douching, and this douching is mostly carried out by women because they think that washing inside the surface of the prepuce make the prepuce clean. So you see a lot of women are advising their fellow counterparts that if you want your prepuce to be clean, wash inside. On no account must you wash inside of your prepuce. The prepuce has some microorganisms, all right, inside the prepuce. Those microorganisms, they are called normal flora of the prepuce. All right, what they do is that they prevent other organisms from causing infection. So when you begin to wash inside, you carry a fluid or any mixture of fluid, you begin to wash inside the prepuce. What you are doing is that you are altering the composition of that normal flora, those organisms. You are reducing the content of those organisms, and you are predisposing yourself to have what we call infection. So if you want to wash anywhere at all, you wash outside of that area, outside. You don't go inside and begin to wash. Don't ever wash inside. Then another predisposing factor that predisposes a woman to have the infection is what we call poor wiping technique of the back door. That one means, say, if you are a woman and you go to the toilet to go and defecate, one of the things that women do is that they carry their tissue paper and they wipe from the back door to the prepuce. They wipe from back to front. On no account must you wipe from back to front. If you want to wipe after defecating, you wipe from front to back, from your prepuce to your back door. Because if you wipe from back to front, some of the feces in that tissue paper will spread to your prepuce. I remember that feces, one of the content of feces is bacteria. Those bacteria will not serve as a needles for infection. So on no account must you wipe from back to front. You wipe from front to back. Make sure as you are watching this video, you are also sharing it.